I'm Neal Lesh. I'm the Chief Strategy Officer of Dimagi. There's a few other folks from Dimagi on the call. I'm going to just specifically call out my colleague, Lauren Magoon, who helped organize all this and is running the Zoom and has been working with me on all this work. And the work I'm going to describe represents our joint work as well as a bunch of other people at Dimagi. And so Dimagi, if you're not familiar with us, is a social enterprise that helps frontline programs leverage digital technology. We're best known for developing the open source no-code platform called ComCare that frontline programs use to equip their frontline workers with mobile apps and also web apps sometimes to improve service delivery, data collection, monitoring and evaluation, and related services. We both build the software that's open source, provide a cloud-hosted version of that open source software, and provide services for organizations that want to have us help them utilize ComCare. We've worked in thousands of projects, a large number of countries, and supported a very large number of community health workers and other frontline workers over our 20 years of being in existence. And we've been around for a while. Each year, every couple of years feels different. But over the last year, we've really tried to reflect a little bit on what our kind of underlying approach has been and the kind of thing we're trying to do. And we've formulated it just recently as that we are pursuing what we call high impact growth. And both sides of this are really kind of important and non-negotiable for what we strive to achieve. Like a lot of the groups working in open source systems, we are trying to do stuff that's high impact, develop digital interventions that will significantly improve people's lives. We have a broad definition of what that means: health, livelihood, agriculture, general well-being. And like a lot of the groups doing open source work for global development and lower middle income countries, we're focused on building things that are inclusive, that work in offline environments, that are suitable for low literate users, and generally are targeted at trying to address global inequalities. And then a little bit different than some of the other groups, or maybe most of the other groups working on open source systems, we also have a particular focus on how to achieve financially sustainable scale. We are looking for interventions that we think have a path to really large growth and can be used by lots and lots of organizations and to serve lots and lots of populations. We focused on building like robust technology that has, first world-class ability to scale, be cloud-hosted, those kinds of things, as well as look for interventions that we hope can eventually scale via the market, that they wouldn't rely in the long term on grants to support the digital components, but rather would eventually be part of operational expenses because the use of digital just overall improves the efficiency and impact and scale of the frontline programs choosing to pay for it. This talk really focuses on a relatively recent initiative to specifically see what we could do in mental health. And it's fairly rare for Dimagi to do this. About 2 years ago, we started to take a look at specifically like how we could invest time and effort and build partnerships around using digital technology specifically for mental health. We often end up with areas of focus. Like we've done a lot in maternal and child health, but it wasn't so much that we identified that and proactively went after it. It was that a lot of our partners were like working on maternal and child health, so we did more and more in it, learned from that, built more systems for it. I would say more or less nobody was really kind of like asking us what we could do in mental health, but we identified it as an important area for us to work in, and now are starting to get a little bit of traction, have a little more clarity about what we can do here. So in that talk, I'm going to describe a little bit about the unmet need in lower middle income countries. Those of you who, it's in the news a lot. Those of you who are certainly in the field for longer would know all about this. We'll talk a little bit about the role for digital solutions in mental health care. And this is very common. Most of the programs we look at or work with or talk to doing mental health care are thinking about how to use digital if they're not already using it. And this leads us to the kind of maybe key point of the talk, which is what we see as our unique role is to create reusable digital components that can be used across lots and lots of frontline programs. And so that's what we're trying to do, and we're hoping to do it with all of you. So what we hope comes next is that you and all your friends partner with us as we go forward. So speaking to that first point, just about the unmet need, I won't belabor it. There's a lot of reports of just like the tremendous number of people who suffer from mental health conditions like depression or anxiety, and the proportion that don't receive care, especially in lower middle income countries. There's just like incredibly little numbers of specialists per population, and so like very, very little available specialist care for the prevalence of the burden of disease. Unsurprisingly, people who are lower income suffer disproportionately from mental health conditions, and it further aggravates their poverty to have it. And on that note, one thing that really kind of drew us to mental health was how clearly it intersects with a lot of other health issues. We kind of like to work on cross-cutting digital technologies, but mental health is a cross-cutting issue as well, and that it underlies a lot of other interventions. So, if you're a person with TB and you're depressed, it's going to be harder for you to complete your TB treatments. If you're pregnant, it's going to be harder for you to follow all the recommendations you're getting about taking iron tablets or care for your children once they're born. And so we really see it as a way to like add to a lot of our other work we do by helping to address some of the root cause of like the bottlenecks for advancing progress towards goals like universal health coverage. We're interested in the full spectrum of mental health. People seem to describe it a little bit differently, but roughly speaking, there's some percentage, maybe 10 to 20%, depending on the population and definitions, that suffer from diagnosable clinical mental health conditions like depression or anxiety, and some percentage of those have very severe cases. A larger percentage are moderate or mild, and then the other, let's say 80% of the population, is also often burnt out, under stress, overwhelmed. I'm sure there's some percentage that is just doing fine, but a lot of people are also needing of resilience or positive psychology, or just general methods of improving well-being that would help in lots of ways, including their quality of life, as well as prevent things like depression or anxiety. I won't spend too much time on this slide, but it's been good to see over even the couple of years that we've been involved, more attention to mental health. We're probably part of this trend of kind of growing awareness of it. A lot of the big things that we're aware of have come out just in the last few years. There's a lot of evidence now of how to utilize non-specialists to provide mental health care, given the lack of specialists. That's really important. And more funding, at least, certainly the conversations I have, I'd be curious if folks have similar experiences. Mental health seems to resonate more with folks. COVID has both made the situation worse, and I think also given more visibility into the mental health needs. And so we see more funding, at least being coming out either specifically for mental health, or more funders having some interest in it. And an insight that's kind of recently occurred to me, and I'm be curious as well if this resonates with you all, and it kind of like clicked as a little bit of a light bulb for me somewhat recently, is that one of the reasons why we can make a difference here is because not all psychological interventions are that complex. I think it would be easy to think that mental health is requires specialists, that you have to be able to get into people's heads, understand their motivations, be kind of like have really special skills to provide help to people who are suffering from mental health or need well-being interventions. And that's certainly true. Certainly plenty of people do require specialist care. But an analogy that gives me some hope might be something, if you're familiar with it, like childhood illness. So like children who have symptoms like diarrhea or fever or coughing. And certainly some percentage of those children need specialist care to be treated, but also been the case that it's now, it's been demonstrated in lots of countries that through protocols and have non-specialists like nurses or community health workers classify and then treat childhood illness without being specialists. That, there's like some standard flow charts or decision rules that you could follow to say, based on the fever, how long they've been coughing, is there blood in the cough, et cetera. Here's a good treatment for them, or they need to be referred for more specialist care. And I think mental health care is a little bit like that, at least, or helping a large number of people, even if not all. So there's work being done to show that non-specialist providers can be trained in relatively quickly to provide either group therapy or one-on-one counseling. We've been working with a group called Sangath in India, part of the Empower program out of Harvard, that has a course that's a couple weeks long, where community health workers with very limited formal education are trained to provide one-to-one counseling for depression that's pretty effective for a large number of people suffering moderate or mild, maybe even sometimes severe depression. And those results are encouraging, and they make sense if you think that, oh yeah, what could help for a lot of people is some of the routine care, it's not all super sophisticated. And similarly, a lot of the positive psychology methods like positive visualization or practicing breathing or practicing gratitude on a daily basis, those kind of methods are, they're not like easy to adopt. They're still difficult to do just to incorporate into one's life, but they're not that like sophisticated or complicated. It's like the adoption of relatively straightforward techniques that provide a lot of benefit. And I think this insight, gives a lot of hope for promising pathways to really expand mental health care and meet some of that staggering unmet need. So training, one route, given like it's almost impossible to imagine, huge numbers of specialists being trained for the countries that have so few currently, but mental health care could be delivered by non-specialist providers like community health workers through programs like the Empower program or other programs that train those non-specialist providers to provide mental health care. There's a pretty clear role for digital there, in that just like it's hard to roll out these kind of like big interventions without some type of digital platform. It's certainly easier with them. And there's a few specific uses of improving quality assurance that fit well with the digital solution. I'll talk a little bit more about those on the next slide. Going all the way to the kind of other extreme, there's the potential for fully automated psychological interventions. So we haven't gone into that too much, but you might be familiar with conversational agents like Wobot or WISA. Sorry, I think there's a typo in my slide. It's WYSA, that have chatbots that deliver fully automated care, I think mostly based on cognitive behavioral therapy. And to my knowledge, they're mostly focused so far on high-income countries and largely in English. Though hopefully we'll expand, and just like that, a good proof of concept that a lot can be done through these ways. I think it builds on a long history of internet-based cognitive behavioral therapy, but adding more compelling interface and conversational agents to help people get through that content more often. And then in the middle are sort of things that we are working on, like creating self-guided applications for people to consume positive psychology content. Like we're working with, we have some funding from Johnson & Johnson to help adapt their resilience messaging program with a bunch of other frontline programs to help address burnout in frontline workers. And it's a series of messages, I think around 82 messages that can be consumed or gone through over the course of 6 months. And if you look at them, I think, to my earlier point, they don't look that, they seem like a fair number of them seem like kind of common sense and natural, but the whole effect can really be helpful to frontline workers who are under duress. So the role that we help to play in all this is to build what you might call a digital mental health toolbox. So not to be like our own providers of mental health care, through a digital intervention, but rather to build tools that could help amplify and scale and improve other mental health care groups. We are glad to see more and more of those coming about, and we think if there's more ways to scale them, then they'll also, they will scale more, they'll attract more funding as they become more effective and efficient. So we're interested in creating, digital platforms for different types of mental health approaches, like one-to-one counseling or group therapy, that could be like a good starting point for programs that want to use a digital platform for their similar programs. We're doing some work where the digital platform, in addition to just kind of managing the day-to-day work, can also provide support for ongoing quality assurance, where non-specialized providers record their sessions and then rate their sessions as well as their peer sessions and then discuss that. This is work done by Sangdoff and Harvard that I mentioned before, and we're just providing some of the digital plumbing to help formalize and scale that idea that they have been demonstrating the power of for the last few years. We're interested in specialized content or digital solutions for like important subgroups. There's a lot of effort and attention to youth because they have like a lot of need for mental health care, as well as maybe there's different needs that they have relative to older populations. A lot of interest in trying to co-create or work with youth-led efforts to figure out what works best. We're really excited to engage with a bunch of groups to see where we can provide some common tools for them, or things like specialized either solutions or content for verticals like people with TB or young parents. And then finally, we're interested in creating like digital components that can be incorporated into larger interventions. So either conversational agents, like we're experimenting with some chatbots that try to teach you a single resilience skill like breathing, or encourage you to do a daily gratitude practice, or building apps that bring you through some self-guided content at your own pace for learning resilience skills. And these are to some extent interventions on their own, but could also, we think, be tested in isolation and then incorporated into larger initiatives. So what comes next is, it's one thing is it's a long effort ahead. We don't think we're going to like come up with a magic solution and just scale it up in the next year or two. We see this as a long-term effort. We're already gaining some traction with just more partners, more projects going on, and we're really hoping to grow that through events like this. We're looking for partners to help us identify use cases, figure out the design requirements for them, to develop specific digital platforms for types of mental health care delivery, test out digital content, innovate on some areas that can be cross-cutting across lots of different mental health care efforts. So if you have any interest in this, please shoot me an email if you don't talk about it now. We'd really love to figure out how we can work together.